next question I'd like to ask Dr. Yoon, that's kind of going through your molecular report, and I think our listeners probably have a better understanding of what they're looking at. I think this question is very, very timely and important. If a hospital that you are at is using a single gene testing, and not NGS, but a single gene testing, and does not find any mutations, can they safely assume that the person has no mutations and make a treatment decision based on it? And if so, isn't this risky? So basically, can you highlight the difference between a single gene testing and next generation sequencing, and what does next generation sequencing brings, and what the pitfalls we have in a single gene testing?
Yeah, so for single gene testing, it's in the name. So we're only looking at a single gene. Whereas, for the next generation sequencing, we're looking at, the entire sequence to look for, a bunch of other alterations. So just because, a single gene test was performed and that's negative, we can't assume that there's no other alterations just because we haven't tested for them. So in that situation, I wouldn't just rely on a single gene test result, if that's negative to provide, my treatment recommendations. I would like to have, information about other genes and do a more comprehensive sequencing to look for other alterations. But, as we talked about before, if there's a time where like a patient is very symptomatic, where we need to start chemotherapy, that might be a situation where we might start some upfront treatment. But, ultimately would want that information with whole gene, next generation sequencing to really do a more comprehensive search to look for other alterations that can be acted upon.
Thank you. And especially like we published in the setting of EGFR exon 20 insertions, that single gene testing for the EGFR misses the EGFR exon 20 insertions in a clinically meaningful number of patients that we missed. And I think the way I kind of like to use non-medical explanations when I talk to the patients, like for example, if you are entering your closet and you have a mind that you want to get a red t-shirt, you're going to completely miss the green one because you were looking for the red t-shirt. So that's why I think it's important for us to perform next generation sequencing. I don't know if Dr. Sen, you have anything else to add from your basic science standpoint?
No, I think they really answered the question well. I don't think I have anything to add to that.